Dr. Bradshaw here, Chirocynergy, and we're talking about the hips, and in this case, stretching out the hips, making them more flexible, not so stiff and tight. Many of you who are watching this are probably having not only hip problems, but may even have some degenerative arthritis in your hips. One of the reasons is these muscles we're going to work on are way too tight. So here's how you stretch them out. We're going to work on the iliotibial band. It's also known as the A.R.T band. That muscle runs from the outside of the knee, along the outside of the thigh, up to the hip socket, and then crosses over and gets up into here, okay? To get the lower part from the hip socket down, we do the foam roller stretch. That's a separate video. This one is to get that section from the hip socket up to the top of the hip bone, right in through here, this triangular part of the muscle. Here's how you do it. So let's say we're stretching out the left IT band. You're going to place the left foot here. You're going to cross the right leg over the affected leg. So if this is the hip that's tight, you put that foot right down there and you're going to cross the right leg in front of it. All right? So the affected leg, the painful hip, is behind the other leg. All right? That's important. Then you're about, a couple feet away from the wall. So you can lean towards the wall with your hand here for balance, and you're going to push your hips laterally that way. Okay? You're not leaning over this way. You can do that, but if you don't actually push the hips this way, you're really not going to get a good stretch. So the key is to think that your hip socket is actually going to translate in this direction, this way. So you're pushing your hips that way, okay? Keeping the arm here. Sometimes I'll even have a patient reach over the top here. That really pulls across the top of that hip socket. Feels very good. And you're going to hold that for a count of 10. And after you get to 10, you come back up, and we do the other side. If you have one side that's really giving you trouble, and I've shown you this video to do, you can do this one twice as much. So do the left side for a count of 10, come over here, do the right side, so the right leg is planted down, left leg crosses in front, and then you're going to lean towards the left, pushing and translating the hips this way, reaching overhead, holding for a count of 10. And then if this left hip is bothering you, come back and do a second set of 10 on this left hip. Okay? Leg down, the good leg in front, and you lean this way. Again, count of 10. That's one cycle. You do 3 cycles a day. Morning, midday, evening. Or if there is an activity which causes this to be aggravated, sometimes it's people who go walking, they feel it. Or when they go grocery shopping, they're going to be just on their feet in general, tends to irritate it. I want you doing this stretch before you go do those activities, or maybe even in the middle of, during that walk, you're going to do those stretches to loosen it up. This muscle is hard to stretch. That is by far the best one to do. If you do this on a regular basis, you will feel that area that always causes trouble with the hip really loosening up. All right, have fun.